San Ysidro Health was started in 1969 by a group of mothers seeking health care for their children. From a 3-room house by the freeway with just a few volunteers, it has grown to a thriving community health center with 27 sites and nearly 2,800 healthcare workers. As they care for the community, there's also tremendous need to care for the healthcare workers themselves.
We serve a predominantly underserved population. San Ysidro Health has also grown exponentially in the last 5 years. You now have a very large workforce you're trying to reach in terms of wellness, and there can sometimes be sort of a disconnect.
The workforce at San Ysidro Health is about 2,800 staff, and they are primarily Latino and mostly female.
Some of the unique challenges that our workforce faces in serving communities out in the rural areas is access, is getting the information and access to those who need it.
San Ysidro Health has long taken steps to support its workforce. As a result, in 2022, San Ysidro Health received a grant from the Health Resources and Services Administration, HRSA, to establish programs and increase their work to improve mental health and reduce burnout among their workforce.
One of the biggest initiatives that I'm really looking forward to is to really put employee well-being at the center of our leadership culture and the day-to-day experience of staff in our workforce. We really need to get our leaders empowered with the knowledge and practice and information to be the best leader that they can be.
San Ysidro Health is shaping healthier work environments and providing support for individuals. The Leadership Training Program empowers leaders to change the workplace to address burnout and improve well-being.
My goal today is to really understand what is burning out physicians and other healthcare leaders and healthcare providers, but also learn how to address it for oneself and for our team.
My responsibility to the physicians within our organization in ensuring they have the tools to be successful and to continue with the joy of medicine, I hold that responsibility very strongly. These leadership classes give us the tools to deal with what we're dealing with and identifying others and really builds a stronger relationship between people.
I'm just so proud that we were able to bring not only funding, but programming to really show these people that the organization cares, the community cares, the government cares, like people care and people want to invest in your personal well-being. We were really fortunate to invest some of it in our Provider Buddy Committee.
We call it San Ysidro Health Buddy System. This is a program that is meant to link newly onboarded medical providers, so physicians or advanced practice providers, with someone who has been working within our organization for at least 1 to 2 years or longer.
It's refreshing to see new providers, sometimes newer out of residency or new in their careers, just to remind you why we're doing all this, why we love what we do. The whole point of the Buddy program is to promote wellness and remind us that we're humans and we're not just in clinic, we're not just doctors all the time, that we're people that try to build relationships with one another, and I think it makes us better doctors in the process.
We recently did a 5K for our participants. It was really great. As people finished the crossing line, we would root each other on as they finished the race.
We've done, I think, a very nice job of collaborating with our partner agencies, both Neighborhood Healthcare and Vista Community Clinic, in really sharing our resources and using each other's support and partnership to get to the meaningful milestones of the grant.
San Ysidro Health has also embedded new programs into their organization. Human Resources rolled out a certificate program to put workplace mental health front and center in training the HR team with new skills.
The Workplace Mental Health Ally Certificate is a program that was designed in partnership with SHRM and PsychHub to provide and equip HR practitioners with information, education, and additional skills to helping support wellness in the workplace. One of my colleagues was doing a site visit and they noticed just some warning signs in the employee. And, we're not here to diagnose, but because of the certificate, we were able to see warning signs that this person might be in crisis.
We really need to start to look forward and start to think about how we can address well-being from an organizational standpoint.
One of the things about the grant is that having the assurance of those monies being available allows us to invest in more ongoing programs that we hope will be able to address some of the systemic change that is needed to continue to improve the organization.
There is definitely a buzz around the organization of wellness, but people are excited about it. We're normalizing self-care. We are prioritizing self-care, so then everyone else can get the best of us, of our organization.